Now in the hands of our host, Sister Bettina Campbell.
Good evening, National Baptist Convention USA, Inc. Welcome to this evening's NBCUSA Hope webinar, Help TempleCare Matters. We acknowledge our national leadership. Dr. Boise Kimber is President. Dr. Christopher Davis is the General Secretary. Dr. Michael O. Miners, National Director of NBC USA Liaison to the U.S. Department of Health and Human Services. In this evening's TempleCare Matter webinar, we will share about October suggested health observances, the National Church Safety and Security Month, National Breast Cancer Awareness, Pregnancy and Infant Loss Awareness, and we will also share about our Sister Against Breast Cancer update. This webinar is part of a continuing series of First Tuesday TempleCare Matters webinars, and each session we will delve deeper into the 7 pillars of TempleCare Matters. Sister Nettie? Now we will hear from Sister Nettie Johnson.
All righty, good evening. Thank you so much, Sister Bettina. I hope everyone is doing well. Just a couple of health tips to share as we get started on today. First, it is time for our triple-demic update. Now, as new cases of the COVID-19 variant are starting to tick up across the United States, we are really happy to share that the federal government is once again offering Americans free at-home COVID-19 test kits. Now, how this works is individuals or households can order up to 4 kits for free. You can do so by scanning the QR code that will appear on the screen shortly. You can also place orders at the U.S. Post Office. And once the order is placed, they will be mailed directly to your home. So you don't have to go anyplace, do anything. They will come directly to you. Now, how many of you took advantage of this health resource before when we were back in the depths of COVID-19? If you can put something in the comments on social media or in the webinar. It was a very, very helpful tool for giving us knowledge so that we can stay healthy and well. And the good thing about these kits that are available now is that the kits that are coming available detect the current COVID-19 variants. And so they can be used throughout the end of the year, which will take us through the holiday season, Thanksgiving, Christmas, and other celebrations. So it's a good time to have these kits on hand so that we can be prepared. What did they say about an ounce of prevention? That kind of sort of thing. Now, the program's website encourages everyone to make sure that you check the test's expiration dates, and you need to check them against the FDA's updated guidance on test shelf life, because you can have some kits with an expiration date printed on them that's in the past, but they may still be good and able to deliver accurate results. So be sure to check on that. Also, HHS continues to encourage us testing for COVID-19 so that if you do find yourself positive with the virus, you can seek treatment, you can self-isolate, you can take other steps, wearing a mask, those things that we know to do so that we can protect our brothers and sisters. To date, the federal program has distributed more than 900 million tests to American households. So make sure to help spread the word so that we can take advantage of this opportunity that is coming forth as we prepare to go into the end of this year. Now, one other thing that I want to kind of share a little about as we come into the end of the year is that October is also the National Church Safety and Security Month. And y'all, sadly, too many churches do not have proper security and safety measures in place. And when they look at the data, they find that this is especially true in small cities and communities. So we're asking all of our church families during this month to set aside some time and to do some safety checks and planning in your church. You can start by being on the lookout for internal safety hazards, everything from like tripping hazards, perhaps loose carpet or cords that may be down, that we have so many more cameras and mics in our cameras in our churches nowadays. Anything like that can cause someone to have an accident and potentially harm themselves. Even think about elements like candles, which are often used in some churches, which if mishandled could be dangerous not only to health, but also to property. We also, y'all, want to consider possible hazards that are not internal, but they can come from sometimes external things, hazards that can come from people. Sadly, we know that robbers and even more sadly, shooters sometimes target churches. It happens, and we must have safeguards in place. So this month, get a team together, identify where your local church is vulnerable and take action. How can you do that? Well, every year there are training guides that are provided and seminars are hosted across the nation that help to equip churches with the right tools and the knowledge that they need to take against potential dangers. So take advantage of those resources. A couple of things to do to start is to assess the safety requirements of your church by doing a safety security check, identifying some of those hazards, things that we mentioned earlier, placements of candles. You might want to inspect your kitchens, your exits, your fire extinguishers, openings, doors in your church that can be easily accessed by trespassers. Take a look at the security level of your church. It also is a good idea to also evaluate your local community, the place where your church sits and served. An evaluation of any hazards or dangers there would be helpful as well. And then make sure that your church has a response plan for emergencies and you have quick escape routes that are tailored according to not only your setting, but the members in your congregation. Y'all, securing our churches against threats. This is a collaborative team effort. And working together, we need to make sure that we are addressing safety concerns, that we determine appropriate goals, and then we follow through in implementing emergency response strategies. All righty, those are the two updates that I wanted to share. Sister Bettina, passing it back to you.
I'm sorry. Thank you, Sister Nettie. That was some wonderful information that we need in order to be able to get our churches on a safe and secure footing. So next we're going to talk about pregnancy and infant loss. It's this is the awareness month for it. And since 1998, the holiday has been time for remembrance and education of all aspects of infant loss, up to and including miscarriages and SIDS. Remembering the babies that have been lost and honoring their parents' grief is a central part of observing this month's holiday, as well as spreading awareness and information about how common this type of loss is. Tonight we have with us Dr. Janae McCoy-White, who is going to talk to us about it. So before she comes, though, let me share a little bit about this awesome lady with you. She is a native of Flint, Michigan, and where she works with the Flint community members and Dr. Jennifer Johnson and Dr. Steve Odersma, and as a part of their research team. And the research is an NIH-funded multi-level intervention that studies African-American maternal morbidity and mortality. And she's in Genesee and Kent counties, which are two counties in Michigan. And she leads the systems level intervention as a part of this project. And she works to develop series of computer delivered messages, videos, and interactive micro interventions to promote vaccination among pregnant patients and newborns. And then she also leads the Apathon community co-creation portion of this project. How many of us know what Apathon is? I don't. Dr. McCoy-White is no stranger to working with Michigan State University and Charles H. Mott Foundation. And her most recent position was as a community outreach program specialist. And in this position, she was instrumental in multiple ways. First, she recruited volunteer physician preceptors. And second, she was responsible for getting medical students actively involved in the Flint community. Lastly, was the facilitating of the Missouri Community Action Poverty Simulation for MSU's medical students, U of M's nursing students, and residents from all the three local hospitals or care facilities there. When she has the time, Janae enjoys spending time with her family, consists of a husband and 3 children. She also enjoys cooking, mentoring, and volunteering. And now she is an ordained elder for the Hands of God Ministry under the leadership of Bishop L. Lee and Pastor Dr. Tanya Bailey. She says she stands on Ephesians 6:10. Finally, my brothers, be strong in the Lord and the power of his might. And she said this scripture has gotten her through both good times and bad times. Welcome, Dr. Janae.
Thank you. Thank you. I think, are we gonna, I think Miss Minor supposed to go next? Okay.
Oh, I am so sorry.
No, actually, you're good. She's gonna come after. She's gonna come after you finish.
Okay, so after me, I'm sorry. Okay, so hello, welcome, and thank you for having me. As you said, my name is Janae McCoy White. I am a researcher, maternal health equity researcher, and my goal for tonight is just to give you some background on what I do. And my research is that it's a multi-level intervention, and it is a multi-level intervention for racial equity, and is stemmed around maternal health. We have an NIH grant that aims to reduce African American maternal morbidity and mortality in Genesee and Kent County. If most people know, African American women are 3 to 4 times likely to die or have a morbidity than our white counterparts. So our Maternal Health Miracle Project is a 5-year grant given by the National Institute of Minority Health and Health Disparities. And this is led by Dr. Jennifer Johnson in Genesee County and Dr. Chris Megahy. I am the implementation practitioner of this. Our 3 levels is level 1 is system level, our level 2 is provider and practice level, and level 3 is community. And so with level 1, when we look at system level, we're focused on enhanced prenatal and postnatal care services. So that's like your healthy start. So we're trying to enhance that. We're trying to make that broader, make that change where they're not on from 9 to 5, but they actually change their hours. They do telehealth instead of just home visits. We try to make it so where those who are having children or had their child, that they don't have to always have that confined from 9 to 5. Our level 2 is our provider practice level, which provides maternal health focused anti-racism training for anyone who is working with pregnant and postpartum women, and you get CME credits. And Mrs. Campbell is one of our facilitators for the anti-racism training. That is very eye-opening for so many people because it's looking at the historical, not just what's now, but historically what has taken place to why it is so bad still now when we have so much technology and so much awareness that's supposed to be out there, but we're still not being treated fairly. And level 3 is where we're working with health providers and other organizations who are working with pregnant and postpartum women to implement community care patient safety bundles, targeting maternal health disparities throughout Genesee and Kent County. These bundles are from the Alliance for Innovation on Maternal Health Community Care Initiative. This is a funded resource by HRSA and Healthy Start. Community care is defined as a care provider by outpatient, our EPCs, and community-based organizations. So today I'm going to talk to you all about our first bundle, which we have implemented, and it's the postpartum bundle. And that bundle, part of that bundle, the biggest part is the Hear Her, CDC Hear Her campaign. And the one thing about this is because what happened is either we'll have a child early if you don't hear her, or the mom becomes harmed. Either there's a morbidity or unfortunately a mortality. And so what we're doing is we're trying to push this campaign to show moms and those who are their loved ones, if they have anything that's going on, any of these warning signs, we need them to go in and be seen, go to the emergency room. And what we have done is we give the warning signs to the mothers, and we hand it to the mothers, and we say, take this with you. Whatever symptom you have, point to it. This is what's going on with me. My vision is blurred. You know what? My legs are swelling way beyond. I can't even put on any shoes. These are signs that they need to be seen immediately. And when they have that, what we have found in our county, that most of the ER quickly listen to them. But if they don't have it, they're not heard. And we don't know the difference. We don't know why. But we're appreciative of that this is out there, and that the CDC and the American College of Gynecology, Obstetrics and Gynecology work together to put this together. So that's the one piece that we have to start thinking about. We also have to start educating and talking to everyone about their postpartum care, even if they have a loss. See, most people think if I have a loss, I don't need to go back. I don't need to be seen. But you still need to be seen, because something could still be going on with you. You still had that child. You still had something going on. Your body's chemistry still changed. The hormones still changed, and you had something inside of you. And so that needs to be checked. You still need to go get your 6-week checkup. You know, what we have found is most people go get their children checked up for their six-week appointment, but they don't take themselves. They don't go. And one of our residency programs, they came up with this. I didn't, because they have a children's clinic. They said, we're saying that they're going to get their baby checked. We're going to ask the clinic, can we have a set up specific days that we can go in so that we can check moms? And that way, the mom doesn't have to have 2 different appointments. She has 1 appointment and everyone's seen that same day, which I thought that was great, because that broke down barriers. That broke down transportation barriers, that broke down missing work, that broke down anything that you can get. And so these are things that we have to start thinking about. The other thing is being culturally sensitive to people, and not, I'll say culturally sensitive, because a lot of times people think, oh, well, they don't really, because I'm not a physician, I don't know what's going on. I may not know the physician's terms, and that's what we have to start teaching everyone. You may not know that physician's terms and their terminology, but you know your body. You know that it's in the upper part of your stomach, in the lower part of your stomach, in the side, whatever you feel, your head, your feet, you know your body. So you tell them that body part of what's going on. And 9 times out of 10, they'll listen. They'll hear you. I had one physician tell me, I always thought I listened to my patients until I really started hearing what you said here in this conversation, that I was checking off boxes and wasn't really listening to them. And it really, it gave me thank you, but at the same time, now you're changing yourself. And that's what we have to do, is get out there to keep this narrative going. And we call the Alliance for Innovation on Maternal Health Community Care Initiative, we say AIM-CCI. AIM-CCI it started in 5 counties, and now it has sister counties. So it's all over. And you can go to their website and you can see their different bundles. But then we talk about, what we don't talk about is the taboo of loss and what to do. And that's still a part of the postpartum. That's still a part of what can we do? How can we help? And that is, once someone has lost something like that, most of the physicians in the OB-GYNs, they do the assessment. They do the postpartum depression assessment on you, and they try to see if they can check a box. But sometimes that's not always that easy, because at the moment that you find out that you had the loss, some people may not grieve right then. That grief may not hit them till later. So giving them a number to call, giving them some coping mechanisms and showing them, here's some things that you can do even if you ever feel down. But we want to make sure that you are getting the proper care and who you need to speak to. And here's some different programs. And I know that I don't know in your area, we have one here in our area. It's called HEAL, and it's Healing After Loss. And in this program, there's 2 different treatment stems. And Healing After Loss, one of the treatments is having that person work through that loss by talking about the loss. The other treatment is focusing on ways to cope with feeling down rather than the loss itself. So everyone is different in how they process loss, how they process grief, and they also work with their loved ones so that they can always have someone there for them. And if they don't, that's when the counselor is there helping them through the way. And so that's a part of that. That's a part of what can we do, and then the postpartum bundle, one thing is teaching them to get that 6-week checkup. I say that because what's creeping up now is most people think hemorrhage, but cardiomyopathy is starting to surpass hemorrhage. And that's something that most people don't even think about. You don't think about your heart. Number one, you think about it, when you having a child, everything is working double. And so your heart changes, your heart muscles change because it has to work for something else that's there. And the bad part is most people don't even get checked about their heart. Most physicians don't even check your heart because they don't think about the heart change. Now they have. I know now that ACOG is starting to work with other places, saying that there is California has a toolkit that you do to see if that person needs to continue to get their heart checked from first trimester, second trimester, third trimester, and now the 4th trimester, which is the postpartum period. So that's also a part of this. And so I know this is a lot of information, but this information is, how can we change the narrative of low birth weights? How can we change the narrative of losing our children when sometimes they can be saved? How can we, with the mothers, change the narrative of morbidity or mortality? Because 83% of the mortality rate can be saved and preventable. But the problem is, they don't hear her. The problem is they pass them off, or they give them less care or archaic, old care. So what we have to do together is work to get this out there, to start talking to people, start telling them what's going on, start pushing the narrative of how can we help? How can we move better? And then also thinking about when people are planning, family planning, pregnancy spacing, all of those things play a part. How can we safely get you to have the child? How can we safely get you so where you're okay? Even with your loss, we want to make sure that you're okay still. What can we do? How can we do these things? I think about personally hearing the physician say, you lost your child. That's a sting. And that was a sting that stuck with me. But what I told myself, which was a false telling myself, you got other kids. You need to just get up, do what you got to do, and keep moving. Until one day it hit me. And I'm appreciative of having a supervisor who is a clinical psychologist. And I went to her and I said, this happened. And I found out that I lost my child. And I said, and I didn't have postpartum depression with my other ones, but now I'm feeling all these things. And she said, then take the time. Take 3 days like you feel. You say you feel like you want 3 days of nothing. Take that time. And that's what you need. It's not, let me keep going. You need to hear somebody to say, take the time to, number one, process what has happened. Take the time to get you healed. Take the time to talk to someone and move forward. And these are programs that can be placed everywhere across the country. We have Healthy Start across the country, of course. That's a federal program. Here in Michigan, we also have the Maternal and Infant Health Program. That is where they have home base, just like Healthy Start, but that's an additional for Medicaid patients, that they go into the home and they work with them until the child is 18 months, just in tandem with Healthy Start. So these are other resources that can be placed in every state so that no one can have low birth weights. What we call it MIHP. MIHP is there to help with low birth weight. MIHP is there to help with morbidity for the mother, mortality for the mother. But how can we do that? If we don't do that across the whole United States, then we fail as a country to make sure no one dies of preventable deaths. No one is harmed from, we get it. Physicians have a few seconds to make a decision about how to get the baby out safely. But at the same time, make sure that that is going to be the way the mother wants it. Talking with the mother, having a birthing plan, having someone there that understands where that mother comes from and how things should go. But we still got to make sure everyone is safe. We got to make sure everyone has the best opportunity to move forward. And so today, I just want to thank you. I have plenty of other things, but I want to make sure I have plenty of time to answer any questions that people have. This is what we really want is, number one, to make sure everyone has a healthy birth, everyone has a healthy pregnancy, and everyone has healthy postpartum. Thank you.
Dr. White, that was fabulous. Thank you. Sister Bettina, go ahead.
I was just going to say the same thing. It is, I've worked with Dr. White. I think this is the most I've heard her talk. and I'm really listened, and I heard a lot. And I had a question about the importance of having an awareness day like today. Why is it for families? How does this help their grieving process?
Right. So what awareness would be is to understand that it's okay to feel what you feel. Number one, most people, like I said, my thoughts was, get up. You got other kids. You need to just keep going for the other kids and until it hits you. Instead of, like, my physician at the time, she was like, are you going to be okay? Do you need someone to talk? Like, she was very attentive. But for me, it was like, I'll be fine. But I didn't realize I wasn't going to be fine. And so today, that's something that we have to tell people. It's okay not to be okay. It's okay to reach out for help. And number one, most people don't even think about when people have loss, especially infants, oh, she had a miscarriage. Oh, that's so sad. And then they're on to the next. Understand that that's a baby, that person still lost. Mm-hmm. But make sure that person is okay, and always let them know there's a listening ear. There's a listening ear. And that's the awareness part of it, is let them say it's okay not to be okay, but there are listening ears to help you through this process. You don't have to go it alone. And families don't have to go it alone, because also the spouse may feel that loss too. So it's not just, yes, mom, but the dad may feel that loss as well, just as hard as mom. So how do we put that together and make sure that both of them are receiving the care they need so that they can go on healthy and mentally prepared to move forward?
You
That's
know,
great
it's
information.
so true that
So
we
it
don't.
sounds like it takes the whole family and the
Yes.
whole community. We have one question from social media. Um, the um, the participant wants to know, what can churches do to help people understand more about this issue?
So number one, churches can always have you can have pamphlets out, but have someone there that has that I would say understanding how to counsel someone through it. So having the resources about counseling for loss, having and then just having maybe a community of people who have lost, to say, we are grieving our loss. How do we cope with these things? What do we do? And so they can be a community with each other and finding resources and talking with each other. But being that resource number one, the first resource is, we're here to listen. We're here to listen, and we're going to walk with you. We're not going to let you go until we know that you're feeling where we know you should be.
Mm-hmm.
And everyone is different. I always tell people, please do not tell people how long they need to grieve, because we don't know. We don't know. And that's one thing that I have learned over the years about different people always, oh, you should be over that by now.
Mm-mm.
No, they should not. They should be over it when they're over it. But we're going to walk with you until you are.
Absolutely. That's great. We're going to end this segment for now. Dr. White, we don't want you to go anywhere, because we're going to have more questions for you during the Q&A at the end. We want to take a moment now to talk about, and thank you for all that information again. Thank you, Sister Bettina, and thank you, Dr. White. Want to take a few minutes now to talk about Let's Move NBCUSA. So we want to keep moving NBCUSA family. And I believe that Sister Nettie might have something to say about that, if she's still able to speak. I think she had a couple of things going on this evening. Are you still able to talk, Sister Nettie?
Yes, Sister Minor, I am here, and these points will be extremely quick. Just a couple of updates to the Let's Move National Baptist family. Last month, our movement focus was on strength activities. That's what we focused on in September. And in October, our focus is strength activities. And here's why. We're continuing on with the same focus. When most people think of exercise, when you say I exercised or I moved today, what do you usually think of? Y'all just go ahead and drop it in the chat, and I'll take a look at them as we kind of come through. I would venture to say that when most people say we work out, we think of things like walking, running, biking, swimming, things that are cardio activities. And while this is great and it is very helpful for our health, and it's a good way for us to kind of get towards reaching the minimum of 150 minutes of moderate intensity activity that we need per week just to maintain our health, what most of us tend to overlook or forget or omit is that the guidelines also specify that adults also need 2 days where we're doing some focused muscle strengthening activities, 2 sessions per week. And this is going to be anything that works our major muscle groups, our hips, back, abdomen, chest, shoulders, arms, etc. Now, why is this important? Just a couple of things, y'all. It's going to help us to maintain our mobility, our flexibility, and balance. This is important through all areas of life, but particularly as we age, because it can help to reduce injury and preserve our independence as we tend to get older. Did you know that strengthening activities also can help prevent chronic disease? Everything like controlling and managing diabetes, heart disease, arthritis, back pain, as well as obesity. It's also really important for our muscle density, bone density, and our strength. It can help to prevent osteoporosis. Again, that's very, very significant, particularly for women as we age. But it can also help with pain management, improve sleep, and there are even mental or cognitive benefits. They have found that doing strength activities in particular can help with depression, and they can also help reduce the cognitive decline that sometimes comes with age. So because it's so often overlooked, we're going to continue to focus on it this month. On the screen, you do see just some of the many resources that are in our Let's Move National Baptist Band regarding muscle strengthening activities. So if you have not pulled it, go pull it. If you have it already, pull it out. And we're going to focus on those activities this month. And thank you to those that are turning in your minutes. Hopefully in next month reporting, we'll see an increased level of muscle strengthening activity so that we're all either meeting or exceeding that basic guideline. On the next slide, you'll also see a reminder of where we can report our minutes. It's that bit.ly/monthly minutes. That's where you can go on ahead and put in your minutes at the end of each month. And we also do have where you can download trackers. So if you need one so that you can back record for September, as well as if you're doing paper recording for the months coming up leading through the end of the year. And then the last slide, and the last thing that I want to talk about is another offering that we are continuing again this fall. It was well received last month. And so this is for any of you that feel that you could benefit from a little bit of one-on-one time to dive into your wellness goals. This is individual, personalized, specific one-on-one time with a certified health educator, health coach, and fitness trainer. So if you could just go on ahead and pick one of those times, and if it has to do with managing weight, eating better, staying active, reducing stress, finding balance, anything around our holistic wellness, this is your coaching moment. And so go on ahead, grab that bit.ly, secure your spot, no cost or anything like that. There's a question so that questionnaire to fill out so that we can make the best use of this time and take advantage of this free resource, personalized, customized to support you. So I'm going to drop all of these bit.ly links into the comments, but if you are in our Let's Move National Baptist Band, they are all there, and we hope to see you over in the band in this upcoming month. Just keep moving and stay well. That's all for Let's Move National Baptist. We're going to kick it back over to you.
That is great. Thank you. So we're going to keep moving, and we're going to continue to keep track of our movement. So now I want to talk just a little bit about something that's relatively new to the National Baptist. We're going to discuss our inaugural Sisters Against Breast Cancers. Sisters in Step to Achieve Success Against Breast Cancer Month. I'm going to say that again. Sisters, SISTAS, which stands for Sisters in Step to Achieve Success Against Breast Cancer. And we have several suggested events for our NBCUSA congregations. And we also have some swag available. And I'm going to turn it over to Sister Bryant if she would like to share with us about those observances that are coming up. One of them actually just happened on the 29th, and she's going to share with us some additional information. It's in your hands, Sister Bryant.
Good evening, everyone. Yes, we are very excited about our new inaugural event. We did have Sunday, September 29th was the pre-kickoff. I did receive some pictures of those who had that sister logo. They were in church. October the 6th, this Sunday, will be Sisters Against Breast Cancer Sunday. October the 13th, Breast Cancer Survivor Sunday. And on October 20th, we're asking our brothers to wear pink. That's Brothers Wear Pink Sunday. And on October 27th would be our closing Sunday. And I'm very excited to say to help the success of all of these events. We finalized the order form today where you can go on bundles of the items. And what we have is We have a basic bundle for $55, which and shipping. And the bundle itself includes the sister t-shirt, and a writing pen. And it's very easy to do. We checked it out today. Your payment methods can be debit or credit card or PayPal. Go in and put the you submit it, and you would get a response that you to if you have additional questions, and that someone will be with you shortly after your order is received, just to review your order with you. And if you had any additional question, there's a phone number that you can call. So we're very excited about that. And I know and once you go into this site, you will see a picture of the bundle also. You'll see the items. And on our last meeting, we're all gonna just be doing our own little individual thing. Next year, for the long-term goal, we will all try to have the walk on the day of the similar Saturday. We were all in unison together. And today it was also suggested I walk this year with the police department.
Sister Bryant.
Promptly, we will leave at 9 a.m. because you can register online or register in person. And the walk, we leave the church parking lot at exactly 9 a.m. after prayer day. Health information shared. We have some testimony from breast cancer survivors. We talk about the statistics of breast cancer. We talk about the importance of getting the mammograms. And yay, we do sort of put you on the spot. Everyone there, we asked, have you already had your mammogram? If your hand does not go up, we ask, do you have your mammogram scheduled? And a lot of times the question is, if not, if you need help getting a mammogram and cannot afford it, we will direct you to resources. And usually those are the last hands that go up. They did not have it done because they could not afford to. We're hoping with NBC for the National Baptist Convention, as we have these walks used to help those sisters or individuals who are less fortunate insurance and who can this year in the past gotten our, we call it the program bus. We bring it to our church and our community, and we put it, and we individuals to show up who have health insurance to get their mammograms done. We will be working on that again for it's in such a demand. You have to start almost a year in advance. So on the screen now, you see the picture of the tote. You see the Sisters Against Breast Cancer hat. You see the t-shirt. And along with that comes a lapel pin and a writing pen. And my email address, I will put it in here. We have certain individuals that are already asking about the bundles and trying to get the information out to them. That's my, and we can send the, think, Dr. They could scan this code, the barcode that's on there now, Dr. Minor.
Yes, ma'am. They can.
So anyone on code and it will come to their phone. It's very easy. Order.
Okay.
And Dr. Minor, my text, we already have our banner in church praying for a cure already for our wall. Another young lady, email address, logo that has, if you screen, it's cancer, October 24, and it has the NBC logo on it. Our person who makes a walk-in this year, we were hoping we could have our anti-H.O.P.E banner, our breast cancer survivors, our sisters behind, using that same logo to the individual to make the banner that way.
Sister Bryant,
Yes.
you went in and out a couple of times, but I think we all got the gist of those dates. We have a month that is full of activities, and we encourage our NBCUSA churches to participate as much as possible. Every church may not be able to do what's listed every Sunday, but do as much as you can this year, and then next year we are going to go all out.
Yes.
There are a couple of questions in the chat. One question for you from Sister Catherine Marvel. Sister Marvel, we're going to unmute you so that you can ask your question of Sister Bryant. If I can unmute you. Dr. Minor may have to unmute you because I'm not able to do it. Dr. Minor, can you unmute Sister? There she is. Go ahead, Sister Marvel.
I'm sorry. I didn't have a question, but I would like to, how can I get a copy of the QR code to pass it on to others in the church? Is it something I can just take a photo of and it will work, or how does that work?
You can drop your email in the chat.
Right.
And we
Okay.
will send it to you. And of course, for
Okay.
yourself, for anyone from your congregation that is viewing right now, they can just scan the QR code from their screen.
Okay.
But for
Real
those that
good.
are not present, if you'll drop your email address in the chat, Sister Brian, if you'll make sure to record that email address for me.
Okay. Put
And-
And
the
then what's the turnaround
website.
time? I'm sorry.
And also, you
We
can take
just-
you can take a screenshot, or you can take your camera on your phone,
Yes.
take a picture of what's on there, and you can text it to some people.
Oh, okay, great.
Okay.
Because I was going to say we put this. Did Sister Marva? Did you hear?
Yeah, to take a screenshot.
Shot.
Yes,
And
I'm looking at that now.
But-
But when we order them, what's the turnaround time on receiving them?
If you put your order in, we expect to have it turn around about 2 weeks. We've got a lot of orders in.
Weeks.
In about 2 weeks and get to us. So hopefully, we're working this year to have things ready for your third and fourth weekend activities.
Oh, okay. All right.
All right. Thank you.
Thank you.
And
Thank you.
because
That's a good question.
because I'm just suggesting that if to particular day that we're doing October the 6th at 8 a.m. All starts at 9. I was trying to figure out the know how we can have some streaming going other individuals?
We can work on all of that. I think we can make those things happen.
Okay.
Sister Bryant, let's talk offline about how we can do that. It could be kind of like a watch party, I think, for those who may not
Right.
be able to walk. We can make that happen.
Okay.
Absolutely. And we'll send out information to those that are interested in doing that. Sister Peel has mentioned about the links for those that may not want to do the QR code. The direct link is our new part of our website that takes you directly to the sisters section of our site. It is https://hopenbc.com/sisters, and sisters is S-I-S-T-A-S, and that is in the chat for those of you that are looking at the chat. Okay. Thank you, Sister Bryant. Great information. We appreciate you. And we've covered a lot. We have covered a lot of information between you and Sister Bettina and Dr. White. We have done much tonight, and I am very thankful that we were able to do that. The best part now is coming up. We want to give more time for questions and answers. If there are additional questions, you can drop them in the chat. You can raise your virtual hand and we'll unmute you so that you can speak. For those that are watching on social media, we'll also do our best to capture your questions. Now, I do see a question in the chat that was directed to Dr. White. The question was, should mothers whose daughters are expecting, and I believe they're talking about, younger daughters, perhaps minors or in their early 20s, very young women, should they accompany those daughters to their checkups even into week 13? Do you think that that's something they should give them some autonomy, some privacy? What is your thought in terms of, and I'm assuming they're talking about in terms of helping nurture those young ladies through the pregnancy?
I believe all people should have someone with them. And they're there for a listening ear and to help. Number one, when you're at the doctor's office, sometimes I don't hear everything if it's about me, but I have someone else there with me and they catch it. And so they're there to help and to clarify, because that person may be afraid to ask questions. And so, before you all go to the doctor's office, you just say, hey, I'm going to come with you. You're good with me sitting in there, so that you can just have a second set of ears to hear what the doctor is saying that we need to do for next steps. Or you remember you had these questions. I don't want you to forget them. So, you may forget, and I can be there to help, ask the questions, and then they can be answered for you. So no, please always go. Always have someone throughout the whole pregnancy. And they can feel, they can feel supported. That's the number one thing. Let them know that.
And that's true for any doctor's visit, I would think, that having someone with you, because oftentimes we get white coat syndrome. And our thoughts tend to escape us. So thank you for that. And even in pregnancy, I'm sure it's probably even more pronounced. Thank you. We have a question now. Is there a website listing these resources about new birth, about new mothers? Is there somewhere that we can direct people in our congregations, an online resource?
We can go to, I can send it. It's to look at different websites, especially AIM-CCI for the bundles. It has the CDC Hear Her campaign information on there, but I can certainly get that to Mrs. Campbell and get all of those websites put up. Yes, I can.
Thank you. Thank you very much. That would be so helpful.
Yes.
All right, we have another question. Is a Black doctor better to understand the special concerns of pregnant Black women, cultural and so forth and so on?
In research, what they have found is that if your physician is of the same culture as you have a better health.
Mm-hmm.
You have better health outcomes. I will say yes with the caution, because we do have some physicians who are be African American, but if they grew up affluent and their patient didn't, sometimes their privilege kind of shows during the visit, as they would say, for someone who's hypertensive and okay, you need to go get these vegetables and do this, never looking at, is there a transportation issue? Is there, a food insecurity issue? So those are things that sometimes, and now some of the medical schools are starting to work through those things and do cultural sensitivity classes, so that then when there are different generations, they understand, hey, you have to kind of check your privilege at the door, because you got to see where your patient is at.
Mm-hmm.
So
Thank you. Thank you.
Mhm.
Another question regarding the loss of infants. Should churches encourage funerals for babies that are stillborn?
I would say it's up to the parent, because some parents may not ever want to see it. You kind of have to, just say, if you want, we're here. However you want things to go. If you want a service, we're here. If you do not want a service, we're still here for you. You kind of want them to initiate that.
Very good. All right. So got a couple of more questions for Sister Bryant, and see if we have any more for Dr. White. Let's see.
One more coming from Dr. White. I'm getting it up now.
Okay, I'm going to go ahead and pose a question to Sister Bryant while I'm waiting for you to post that one. Where can we send pictures of our sister walks?
Walks with this come under walk of the walk they was talking about.
Well, I would think our upcoming walks, and I would add to that question, even the events that people may have had this past Sunday. Where would you like those pictures sent? I think a central starting point would probably be your email, and then future. Okay, I see a response.
Yes.
Mr. Carper has answered. info@hopenbc.com, and we'll give
Okay.
you access to that.
Gotcha.
info@hopenbc.com for anyone who has pictures to send, and we will make sure that Dr. Bryant gets those pictures, and we'll make sure she has access. Last question, and I think that probably Sister Bryant and myself and everybody else in this call is going to answer this question in unison. The question is, will National Baptist continue to promote sisters in the future? So on the count of 3, 1, 2, 3, there should be a resounding yes, absolutely. And the thoughts behind that is simply that there is nothing wrong with the entities that already exist to address breast cancer, but most of the time, the face of those entities does not look like ours. And we know that when it comes to breast cancer, the survival rate of African American women is far less than that of women from other cultures. We get diagnosed less frequently though. And the reason for this is we don't see the doctor soon enough. So oftentimes when we get seen, we are already very, very ill. So that's why the death rate is much higher for us. I said all that to say, unless you understand our culture, or to put it in colloquial terms, walk in our shoes, and understand how the social determinants of health impact us as African American women, no matter how good those other entities are, there's always going to be a missing piece. Additionally, by having this base within the National Baptist, we can work directly with households of faith, because we know that in our culture, most of the time we are very tied into our churches. We believe very strongly in the power of prayer. Most of us believe that whether the Lord heals us from breast cancer or not, we know as believers that it is okay. We pray to be healed, and that's what we want for everyone. But faith comes in very strongly with us as a people. So to answer that question, yes, we will continue to promote sisters. I know as long as Dr. Miner, myself, and Sister Bryant have any part of dealing with hope, that will happen. That will happen. Did I answer appropriately,
Absolutely.
Sister Bryant?
Absolutely.
All
Yes.
right. Wonderful. One more question for Dr. White. If a pregnant woman is in a state that has banned abortion and simply needs a DNC, what are her choices?
State she lives in.
I live in Michigan, and that's it's really hard to say, because you need a DNC, and they will not do one unless you are about to die, unless they see you bleeding and you are on your last limb.
Mm.
Unfortunately, you would have to go to a state that does not have anti-abortion laws.
Mm.
That is my personal. This is nothing that Michigan State University would endorse. They would endorse that you have to follow the laws of your state, unfortunately.
Am I correct that DNCs are not only for abortion purposes? There are other reasons that women have DNCs.
Right. So they also have them for, ectopic pregnancies,
Mm-hmm.
to help clear out.
Mm-hmm.
They also help with fibroids.
Mm-hmm.
So they have DNCs for other things than a pregnancy. And the sad thing is that those who are making the laws did not go to medical school.
Mm-hmm. Mm-hmm.
And they aren't even listening to those who went to med school. And I'm sorry to say, if you did need a DNC because you were pregnant and you are starting to bleed out and you know that you're miscarrying, they will not do it until they know you are about to die. That's what we have seen so far.
So, Dr. White, would that be the reason why, even before the abortion bans, that some medical facilities would send women home when they were miscarrying, and there would be several days before they asked them to come back for a procedure?
I don't know their reasoning. I can't say their reasoning behind that. That is unfortunate that they have someone with a unviable fetus in them for so long. But yeah, that is totally up to that provider why they're saying, just come back in 3 or 4 days. It's not because it was a law. It was just that particular
A bad decision.
facility.
Mm-hmm. Wow. Wow. Thank you. Thank you. That is heart-wrenching information, but it's information that we need to know. All right. Thank you. Thank you both, Dr. White. Thank you, Sister Bryant. I think that those are all of our questions from the chat and from social media. Thank you all for your questions. We appreciate your input, your questions. It made for an even more lively discussion. As we get ready to close, let's not forget our October marketing updates. As Sister Nettie has said, this is National Church Safety and Security Month. We know that it is National Breast Cancer Awareness Month and Pregnant and Infant Loss Awareness Month. And you can download the toolkits from our hopenbc.com website, which you see on the page, And you can also download the complete list of annual health observances from our HOPE website as well. And that site is www.hopenbc.com. You'll also find other information and resources on our webpage. So just spend some time perusing. It is good reading. It is information that will help you and your congregation and the community you serve. Our upcoming events, the Sunday School Publishing Board Educators Conference, will be held in Nashville, December 1st through 3rd. For more information, you can email us at info@hopenbc.com. The agenda for our next NBCUSA Hope Temple Matters webinar, which is going to be held a little bit more than a month from now, November the 12th. Same week as the presidential election. Our general agenda for that will be pancreatic cancer awareness, Alzheimer's disease awareness, and National Caregiving Month, American Cancer Society Great American Smokeout, which is on the 15th, and the Pancreatic Cancer Purple Light Sunday on November 17th. And you can join that broadcast just the way you've joined this one, either by web or by social media. Remember, again, I'll reinforce our webpage, www.hope.nbc. Our Facebook page is National Baptist Convention USA Incorporated Hope Health Initiative. We're on Twitter at Hope_NBCUSA. And then our YouTube channel is NBCUSA Hope. If you would like to enroll in the Hope Health Ministry training, whether you want it in person or self-paced online, you can email us at info@hopenbc or call 901-603-0762. That's 901-603-0762. And as always, we appreciate your feedback. We want to hear from you. We do encourage you to complete our survey. We've pasted the link in the chat for you to complete the survey for this particular webinar. And as we get ready to close, we want to say again that we appreciate the tireless work of our entire NBCUSA Hope team. Our leader, Dr. Michael O'Miner, Dr. Desi Levy, Sister Nettie Johnson, Pastor Dexter Moraney, Sister Ellen McKnight Hill, Dr. Felisa Washington, Minister Geraldine Moore, Sister Loretta Miller, Dr. Lavore Williams, Sister Bettina Campbell, Dr. Marion Talley, and Brother Thomas Duke Robinson. Our 7 regional coordinators are Pastor Daniel Blackburn in the Northeast, Sister Brooklyn Rogers in the Southeast, Pastor Bernard Montgomery, Southwest Region 1, Sister Linda Copper, Southwest Region 2, Sister Teresa Fales-Farr, the Midwest region, Sister Tafara Robinson, the West, and Pastor Richmond Johnson, the Far West. If you'd like to connect with your regional coordinator, same email address, info@hopenbc.com, and we do monitor that email address, so we will address your concerns. So we know that some of you may have additional questions or comments, so we're about to formally close this evening's webinar in just a moment. For those that are joining us via Zoom, we will open the mics for just a few minutes for general Q&A, and we will see you all again, if it's the Lord's will, on November the 12th, 2024, for our next TempleCare Matters webinar. And before we close, we'll acknowledge again our president, our new president, Dr. Boise Kimber. He reminds us that we are the convention where everybody thrives. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless you and God keep you is our prayer.